Good morning, my friends. Uh, Today, I will discuss a few common questions that many of my patients ask me, and maybe that there's still confusion about the answers to those questions. Firstly, a common emergency that many of us encounter is that if you have a sudden rise in BP, say at 2 a.m. in the night, or at any odd hours where you cannot contact your physician, what should you do? A sudden rise of BP more than uh, say 180 by 90 or 170 by 90, greater than that, you can safely administer a tablet of amlodipine 5. I wouldn't take any brand names here because it will be unethical. You can safely administer one tablet of amlodipine 5 to the patient and then contact your doctor. Secondly, what is the safest antipyretic? Antipyretic means a medicine which acts against fever. The safest medicine which acts against fever is paracetamol. Whether you can give paracetamol to any patient, almost in all patients, except in patients with jaundice or liver failure. Those patients, sorry, one paracetamol of course won't affect, but further use of paracetamol should be according to the physician's advice. Sometimes patients come to me with a body weight of more than 70 or 75 kg. In their case, paracetamol 1000 will act better rather than a lower dose. In case of unknown fever, especially in the monsoons when dengue is prevalent, especially in our areas like Kolkata or in other metros, use of other antipyretics except paracetamol can be risky because in case it turns out to be dengue, platelet count can be affected. So paracetamol is the only safe anti-fever medicine for dengue patients. Different adult vaccinations we'll discuss in a separate video. Whether use of overuse of calcium can be hazardous to the health, yes, it can be, because prolonged use of calcium can sometimes cause calcium deposits in different tissues, and if it deposits in the kidney, it can turn into a stone. So we recommend use of calcium like continuous for 2 months, one tablet daily for 2 months. Then it should not be used for another 2 months. Then again you can restart for 2 months, and like that. And often I find, though the situation has improved, still patients often ask for vitamins. Unnecessary use of vitamins can cause different harmful side effects as well. So even if you do use vitamins, you should use for a limited period, like maybe 20 days, 1 month, or maybe 2 months, or according to the physician's advice, and not for a very, very prolonged period. That is not recommended. In case of diabetic patients, we find that many diabetic patients get vitamin D deficiency. And again, the vitamin D deficiency can cause more severe and resistant diabetes. So in case of diabetic patients, vitamin D should be checked at least twice a year, if not more. and correction of the vitamin D should be initiated as and when required. Also, many diabetic medications and also the diabetes disease cause vitamin B12 deficiency. Now, vitamin B12 deficiency is common in our country because of vegetarianism. Many at least 30% of our population are vegetarians, and vitamin B12 is such a vitamin which is more prevalent in, almost entirely prevalent in animal food. So vegetarians are naturally vitamin B12 deficient, and medicines like metformin can aggravate vitamin B12 deficiency. So in diabetic patients who are taking anti-diabetic medicines, vitamin D and vitamin B12 both should be checked periodically, and any deficiencies should be corrected, because vitamin B12 is extremely important for hemoglobin and nervous system. So these two can get easily affected by vitamin B12 deficiencies. If you have any other questions which come to your mind, kindly you can message me in this video or in other my videos, and as and when possible I would take up these questions and try to discuss them, because this channel is entirely for my patients. This channel is completely dedicated to my patients, and whatever help my knowledge can, if my knowledge can help my patients, I would be honored. And so if you like these videos, you can subscribe and may like these videos. So we will discuss adult vaccinations in our next video. Thank you. Namaskar.